Hello, my name is Max. I'm going to be hanging a piggyback line and bag. May I get your name and date of birth? So it's Harris and Jenny. And I would go ahead and inspect their IV site, make sure it's not infiltrated, redness, swelling, pain. I go ahead and assess their primary line, make sure there's no air flowing into the line. I'd know what's going in. I would also check the label, make sure the date, time, and the tubing are all correct. Make sure the tubing is no more than 72 hours old, the bag 24 hours. And now I'm ready to go ahead and hang my piggyback bag. So, in order to maintain medical asepsis, use some gloves. And my bag here is already open, so I would actually have a cap here. And I have my secondary line tubing. And I would go ahead and remove this cap, remove the cap from here as well, and then spike my secondary tubing to my piggyback bag. Make sure this is clamped at 1 to 2 inches below the drip chamber. And then I can go ahead and prime my secondary line. And of course I'd assess my patient, since this is a medication, I'd assess their allergies, their 5 rights, as well as the concentration of this medication. Now I can start priming my line. So you'd want a trash can also to try not to get this everywhere. I can just go ahead and leave that cap on to keep my line sterile. Alright, so now that my line is primed, I make sure there's no bubbles in it, or I can hang it and then do it in just a second. I go ahead and hang my line for my secondary bag. Make sure my cap is still on the end of this. And now I can go ahead and lower my primary. So now that I've lowered my primary, I can attach my secondary to the primary's line. So I go ahead and use an alcohol swab. Trash can. I go ahead and swab for about 15 to 20 seconds. Throw this in the trash as well. Take my secondary line, remove the cap, and insert it into the primary line. And I go ahead and assess this for bubbles. Make sure to flick them out. I got a little one right here. And have it go up through the tubing. Alright, so now I go to my pump here. You can go ahead and hit, on these pumps, all pumps are different. I can hit piggyback here. I first stop my infusion. Stop it. Go to back to my primary. Go to piggyback. And then I can set my rate and my volume. So let's say the rate, I want it at, let's say 50 mLs an hour. And then my volume to be infused, for example, we can just say at 250. Or actually, this bag will be 500, so let's just say 500. And then once I have my volume and rate proper, correct, I can go ahead and hit start. And then just like with any other medication, you make sure you document, you make sure you're assessing the patient for any type of reactions, allergic or what have you. Make sure to assess your IV site regularly for any infiltration or redness, swelling, pain, etc. And let it flow.